Hello everyone, my name is Bree and today I will be presenting information for my class, Advanced Studies, Infant and Child Development. So today we will be talking about the autism spectrum disorder. So what is autism, you may ask? The autism spectrum disorder is typically diagnosed in childhood and has a wide range of symptoms, some being more severe than others. These symptoms consist of communication, socialization, behavioral and interest impairments, as well as minimum social skills. Due to these symptoms, a child with ASD may have trouble relating to peers and forming meaningful relationships. So autism is a lifelong development disability that interferes with a person's ability to communicate and develop social relationships. Often those who have ASD experience challenges in three areas. This includes number 1, impaired socialization, number 2, impaired communication, and number 3, restricted interest or patterns of behavior. Now, as for impaired socialization, this includes that the children are content to be alone. They have difficulty initiating in social situations. They have trouble showing different emotions through body language and facial expressions. They have difficulty with physical imitation, poor peer relations, problems understanding social rules, and difficulty making eye contact. With impaired communications, they have problems following verbal directions. They may talk about the same topics over and over or ask the same questions over and over. They often interrupt others' conversations. They have problems initiating or ending a conversation. And they sometimes have unusual speech patterns and or voice quality. They have difficulty asking for help. They'll sometimes repeat phrases or words from present or past, use jargon or meaningless language. With restricted interests and patterns of behaviors, they have difficulty making transitions, sometimes get upset with changes in schedules, unusual sensory responses, this includes noise, textures, etc., difficulty making choices, or they may choose the same things over and over. They have a desire for sameness, and this includes their schedules, routines, placements of objects within the area. They may have unusual body movement, which includes rocking, finger flicking, jumping, hand flapping. They engage in compulsive actions, and they develop patterns of behaviors that are followed ritualistically. Okay, now let's move forward to the impact that autism spectrum disorder has on developmental milestones. Sometimes children with autism miss multiple milestones and have clear and obvious developmental delays. Children with autism also learn and behave differently from their typical peers. The development skills of a child with ASD could progress normally in the first years of life, but then deteriorate or progress no further. It has been reported that up to 30% of children with ASD regressed in their development or completely lost the skills before the age of 2, and up to 11% of children who are diagnosed with ASD prior to the age of 2 had development skills that did not progress any further. Now we will look at the impact of the development across many domains, including health and physical, as well as social and emotional. As for language and communication, ASD typically interferes with the development of language because it interferes with brain development and alters the way the brain responds to environmental inputs. Many children with ASD develop language skills at a different rate and different order than typically developing children. As far as their emotional and social development, those with ASD have difficulties recognizing and regulating emotions. They often prefer to isolate themselves rather than being around each other. And due to difficulty recognizing social cues, they may not recognize when they are interrupting. Next, we will focus on the impact that autism spectrum disorder has on brain development. Imaging studies of people with ASD have found differences in the development of several regions of the brain. Studies suggest that ASD could be a result of disruptions in normal brain growth very early in development. These disruptions may be the result of defects in genes that control brain development and regulate how brain cells communicate with each other. Okay, so let's talk about the impact that it has on family life. The impact that it has on the family unit is very important to consider because family is often who we form our first relationships with. Some of the challenges that families face includes it's harder for them to get things done because of the excess demands. There are often strains on marriage and personal relationships, and it's an increased demand on some of the family members. It strains and changes their employment of the parent or caretaker, which increases financial burdens from issues relating to employment, therapies, medical bills, etc. Considering some of the challenges that families face when having a child with ASD, it is important to give effective parenting and caregiving practices. Here's a list of things that families and caretakers could try, and this includes focusing on the positive, staying consistent and on schedule, give it time, take your child out for everyday activities, and get support, whether that's emotional or financial. Because autism spectrum disorder occurs in all racial, ethnic, and social economic groups, I thought that it would be nice to include this quote from Adele. Adele stated that children with autism are colorful. They are often very beautiful, and like the rainbow, they stand out. I think that this is important to consider because although many children have autism, autism affects them differently. Okay, so now let's focus on some of the social, emotional, and education needs of children with autism spectrum disorder. Children with autism have a difficult time recognizing and regulating emotions. This makes having social awareness and making responsible decisions difficult as well. Social emotional learning, SEL, can help children with autism develop an awareness of emotions and build social relationships. Most children begin emotional development at birth with expressing emotions, reading facial expressions, and continue to develop skills of empathy and relationship building as they grow. However, for children with autism, they have a harder time with this development, which includes having a difficult time understanding their own emotions. And depending on where they are on the spectrum, some children might be able to express their feelings but are unable to describe what it is that they're feeling. So this would kind of help as far as addressing the social emotional aspects. As for educational, parents may need to coordinate individualized educational plans to support the developing needs of their child. Now let's take a look at the monitoring and screening for autism spectrum disorder. The American Academy of Pediatrics, AAP, recommends developmental and behavioral screenings for all children during regular well-child visits at the ages of 9 months, 18 months, and 30 months. In addition, AAP recommends that all children be screened specifically for ASD during regular well-child doctor visits at 18 months, 24 months, and additional screenings might be needed if a child is at high risk for ASD or if behaviors sometimes associated with ASD are present. I'd like to end this presentation with a short TED Talk by Samuel Beldie about his autism experience. Let's take a look.